Can subclinical hyperthyroidism cause bone density loss? Imagine your bones as a busy construction site constantly rebuilding and breaking down. Thyroid hormones are like the workers that help keep this process balanced. When these hormones are too high, bones can start to break down faster than they rebuild, leading to weaker bones over time. But what about when thyroid hormone levels are normal, yet the thyroid-stimulating hormone is low? That's what we call subclinical hyperthyroidism. In this condition, the thyroid gland is subtly overactive, but the usual signs are missing. People often feel perfectly fine, and blood tests show normal levels of T4 and T3, the main thyroid hormones. However, the low TSH indicates the gland is working a bit too hard. This situation is common, especially in older adults and postmenopausal women who are already at higher risk for osteoporosis. Research shows that in postmenopausal women, subclinical hyperthyroidism can be linked to lower bone mineral density, especially in the hips and spine. Studies have found that women with TSH levels below 0.1 milli-international units per liter are more likely to experience bone loss and fractures. The longer and more suppressed the TSH, the higher the risk. Even milder cases, where TSH is between 0.1 and 0.45, might slightly increase fracture risk, but the evidence isn't as clear for these. For men and premenopausal women, the connection is less certain. Their bones tend to be denser and more protected by other hormones, so subclinical hyperthyroidism doesn't seem to cause as much damage in these groups. The main reason for bone loss appears to be increased bone turnover, where old bone is broken down faster than new bone is formed. Even if thyroid hormone levels are normal, the low TSH might reflect a subtle excess of activity at the tissue level, speeding up bone resorption. It's worth noting that not all studies agree on this link. Some large-scale research in older adults has not found a clear connection between subclinical thyroid issues and fractures. Differences in how studies are designed, the populations involved, and how they define subclinical hyperthyroidism can influence results. Still, the overall evidence, especially in postmenopausal women, suggests that subclinical hyperthyroidism can contribute to bone loss and increase fracture risk. Because of this, healthcare providers often keep a close eye on bone health in people with subclinical hyperthyroidism. Monitoring bone density through scans and considering treatment to normalize thyroid function might be recommended, especially for those at high risk for osteoporosis. But treatment decisions are personalized, based on the individual's overall health, risk factors, and preferences. In summary, subclinical hyperthyroidism can indeed lead to bone density loss, mainly in postmenopausal women with more significant TSH suppression. The risk is lower in men and younger women. Regular checkups, bone health assessments, and tailored management are key. If you're concerned about your thyroid or bone health, it's always best to talk with your healthcare provider who can give advice specific to your situation.